Can nurses pronounce patients dead? Well, let's talk about it. I recently made a shift recap video where I mentioned that I assisted another nurse in pronouncing a patient dead. And this raised a lot of questions about, can nurses actually pronounce patients dead? And the answer is yes. In most states, it is within a nurse's scope of practice to pronounce a patient deceased. Now, the actual policy or protocol may vary hospital to hospital. For example, at my hospital, we have to have 2 nurses pronounce a patient deceased, and we have to have an order from a provider in order to be able to do this. It is important to mention that these patients are expected to pass. This order is placed by a physician that says 2 nurses are allowed to make this pronunciation. These are patients that their death is imminent or expected. Most deaths in the ICU are anticipated or expected, meaning that this patient has been very, very sick. We've tried everything. Families agree to withdraw care, put the patient on comfort care, and the provider will place an order saying that 2 nurses can pronounce this patient when they pass. So how do we do this? Again, check your hospital's policy, but most of them are going to be very similar to this. So when we go to pronounce a patient that has passed, we have to make sure they're not having any movements. There's been no respiratory effort for at least 1 minute. There's no heart sounds, or we will palpate either the carotid or femoral artery to make sure there's no pulse. Absence of reflexes like a corneal reflex, cough, gag, and then the pupils should be fixed and dilated. So 2 nurses assess this. We also document this. Typically, patients in the ICU are still hooked up to a cardiac monitor, so it's pretty easy to tell when a patient passes away because of their heart rhythm. Not that that's foolproof. You still need to make sure you do all these things. Some deaths that we would not pronounce as nurses would be if a patient, let's say, comes in from the ER, goes to the ICU, they code unexpectedly, we're doing CPR, we can't achieve ROSC, and the family or providers make the collective decision to not, attempt any more CPR measures. That would be an example of where the provider would pronounce that patient that has passed. Sometimes if the patient is going to be an ME's case, we will not pronounce. If a patient is brain dead, or if they are going to be a DCD case, a death after circulatory or cardiac death, the provider would pronounce that patient dead. We would not do that as nurses. So yes, I hope that explains things, and let me know, because I'm in Arizona, so I don't know every single state's rules, but let me know where you're at if you're allowed to pronounce a patient dead, and if there's any other different variables that I didn't mention here.